I'm a pharmacist at Parkland Health and Hospital System. Today I'm going to teach you how to use your insulin. There are many different types of insulins. It is important that you learn how you could use insulin the right way. If you do not use it the right way, it may not work as well as it could. The basic way to use any insulin bottle with a syringe is the same, and we will go over these steps in this video. This video will not focus on mixing insulins. If you need to mix your insulins, please talk to your provider. Let me show you the different parts of the insulin syringe. There is a cap at the end of the syringe. This covers the needle. The barrel shows how much insulin you are going to inject. The plunger is what you will push and pull to get the right dose of insulin. There are 2 different syringe sizes that your provider may order. If you are taking less than 50 units per dose, be sure that you have the half cc syringe. This is the syringe that holds up to 50 units. If you are taking more than 50 units in a dose, you should be using the 1 cc syringe, which will hold up to 100 units. Before you give yourself your insulin, it is important to have all of your supplies ready. You will need your insulin bottle, syringe, alcohol pad, and a container for your used needles, also known as a sharps container. Also, remember to wash your hands with warm water and soap and let them dry before you prepare and inject your insulin. Talk to your healthcare team about whether or not your insulin should be clear, like water, or cloudy, like milk. If your insulin should be cloudy, gently roll the bottle between your hands for 10 seconds to mix it well. Do not shake the bottle. Take the cap off the insulin bottle and wipe the top of the insulin bottle with an alcohol swab. Carefully take off the cap from the insulin syringe. Pull the plunger back to let air into your syringe. You will need the same amount of air as the amount of insulin you plan to draw up from the insulin bottle. For example, if you are going to use 20 units of insulin, draw up 20 units of air into the syringe. Push the needle through the center of the rubber stop on the insulin bottle. Push the plunger in order to push the air into the insulin bottle. Leave the needle in the insulin bottle. This makes it easier for you to drop the insulin out of the bottle. Turn the insulin bottle and syringe upside down. Make sure to keep the syringe straight inside the bottle so you don't bend the needle. Slowly pull the plunger back until you get the right number of units as ordered by your provider. When pulling the insulin into the syringe, look for air bubbles in your syringe. Air bubbles in the syringe mean that you will get less insulin than you need. If you have an air bubble, flick the syringe with your finger to make sure bubbles rise to the top of the syringe, and then carefully push the air bubbles out of the syringe and back into the insulin bottle. Check to make sure you have the right amount of insulin in the syringe with no air bubbles. When measuring your dose of insulin, be sure to match up or line up the top of the plunger with the correct syringe, marking for your dose. There are a few things to remember when you inject your insulin. Change the area where you inject your insulin. Do not inject in the same place over and over again. Do not inject into scars, wounds, or infections. These are the parts of the body where you can inject your insulin. Your belly is the best place for injection. Just make sure the insulin injection is at least 2 inches away from your belly button. Next, use an alcohol swab to clean the skin where you're going to inject the insulin. Once the alcohol has dried, gently pinch an inch of fat. Hold the insulin syringe and keep it straight. Gently push the needle all the way into your skin. You cannot hurt yourself doing this. Let go of your skin. Push the plunger all the way in and slowly count to 10 to let the insulin absorb into your body. Then take the syringe straight out from your skin. Do not rub the place where you injected. Let's go over the important points of injecting your insulin with the 5 P's. Pinch the skin. Push the needle all the way into your skin. Push the plunger all the way in. Pause after injecting and slowly count to 10. Pull the needle straight out. After injecting, do not put the cap back on the syringe. Throw the syringe into a sharps container. If you do not have a sharps container, you can use an empty, thick plastic container like a bleach bottle. Do not use thin plastic containers like a milk jug because it is too thin and should not be thrown into the regular trash. Also, do not recycle when they have needles in them. Remember to shut and tape the lid when full and throw in the regular trash. Keep this container where children and pets cannot get to it. Now that we have gone over the steps on how to use your insulin, there are a few more important things to remember. Talk to your healthcare team to see if your insulin should be cloudy or clear. Throw the syringe in the sharps container after you inject your insulin. Do not inject in the same place over and over again. Never use a syringe more than once. Store your insulin in the right place. As for storage, keep insulin bottles that you have not started using in the refrigerator. The insulin will stay good until the expiration date listed on the bottle. Store insulin bottles that you are using at room temperature. Once you have opened your insulin bottle, it is good for 1 month. Do not freeze insulin. Keep out of direct sunlight and heat, and do not leave it in your car. Check your insulin for crystals, flakes, or lumps before you use it to make sure it has not gone bad. Do not use insulin that has crystals or lumps in the bottle. If you have any questions about how to use your insulin, please ask your healthcare team.